Okay, and so the only last question that I would ask you is because of your line of profession and like the situations that you see, the awareness of those situations may not be as complete as it could be.
Yeah.
So how would you like what would you think would be the best way to get people more involved and more aware? Is that even something that should happen?
I think it is. Well, and so again, seven part of what Seven Counties does is help people with mental illness.
Mhm.
And my dad has had major depression most of his adult life. I've had some issues with anxiety most of my adult life, which is 20 years, half my life.
Mhm.
Um, I think we just have to keep talking about it. I mean, so Patty Duke died yesterday. One of the things that she's known for is that she had bipolar disorder and she was public, and
Yeah.
her name is on two different posters at work.
She's a celebrity.
Right, right, and not just for being in the Helen Keller movie and
Right.
the Patty Duke show. Um, I don't know. I think we need to continue to combat stigma around it, particularly around mental health and behavioral health.
Do you think that there might also be like an issue with how like the workers that are who do work in these fields, like do you think that they are still treated with the dignity that they're supposed to be treated, or do they still treat the people who are they're trying to help with the dignity, or is there a line where sometimes people lose that?
I think probably all three, because there's conceivably there's some sort of bell curve. Some people really go out of their way to be respectful and considerate and treat other people the way they want to be treated. And then there's people who, for whatever reason, can't or don't or won't. And there may be moments for someone who normally is respectful where they
Mm-hmm.
aren't.
Anymore.
Yeah. Well, and I would say the fact that this is safety net. This is not people who live in the Highlands who need to see a psychiatrist
Right.
or have therapy. This is people who don't have the resources or have public insurance. And most the people that I work with, we don't make the same wages as people do in the city. And if we're going to have these jobs that are publicly funded, there should be some sort of parity with people who have the same occupation. I'm not saying it's going to be the same
Right.
because there is a difference between private and public money, but maybe that would help with people not being shitty. But most of the people who I've met so far have been there for a long time,
Mm-hmm.
and so I don't think it's money, because if it was money, you would leave. You wouldn't stay for
Sure.
20 years. So there's something else.
Do you think that's like part of humanity? Like we want to help each other?
I think people fundamentally do. I think it's biologically how we're made, but I think like different things bubble up more in different people, just like different intelligences might. So
Mm-hmm.
I might have a drive to give, to help in one way, whereas you are driven to help in another,
Yeah.
versus you might be driven to help in another. So it's different in different people. I don't think it's a one size fits all, because we're not all the same and we're not supposed to be.
Mm-hmm. Okay.